Now we will proceed further and try to learn a new topic by name rules to be followed by the doctor in selecting the correct remedy to a patient after preparing case sheet. 1. Examine the patient carefully and prepare case sheet. 2. The totality of the symptoms should be given prominence instead of a single symptom. 3. The generals, mentals and modalities of a patient should be compiled carefully, and an identical remedy which can generate the same symptoms in a healthy individual should be selected from materia medica. In selecting a remedy, the following principles should be followed carefully. Start from the generals. Proceed to the mentals and verify with the modalities. When we treat a patient, the generals, mentals and modalities should be similar to those of the medicine. The more the similarity, the fast is the cure. For patients suffering from chronic miasms or overdrugging, suitable remedy should be arrived at based on generals and mentals. In a chronic patient, even if general symptoms do not agree with those of the selected remedy, it is sufficient if the mentals agree. In such a case, the indicated remedy, when administered, will cure the chronic disease. While treating patients weak and low in vital force and about to die, we have to use such medicines like China, Lycopodium, Lecithin, acid fast, etc. for some time. When the vital force becomes stimulated, then a complete case sheet should be compiled with all the generals, mentals and modalities, and then an indicated remedy should be selected. This remedy will cure the disease and restore the patient to health. Instead, if we administer the correct drug to the patient who is in dying condition, vital force cannot fight with the artificial disease caused by the medicine, and consequently the patient may die. For patients habituated to allopathy for a long time or unscientific usage of homeo medicines, we should not try to compile the case sheet immediately when they approach, because of the fact that the symptoms presented by them might have been generated by the medicine they used. In such a case, we have to use alpha mother tincture initially for 2 weeks or more. Then symptoms caused by medicines will disappear and true symptoms are exposed. Now we have to take the case sheet and select the correct drug. For patients who have misused homeopathic or allopathic medicines for a long time, we should use remedies like Nux vomica, Pulsatilla, Sepia and Calimore initially for 1 or 2 months. Then the symptoms caused by overdrugging will disappear and true symptoms get exposed. The totality of the symptoms should be considered from the case sheet, and the indicated remedy should be administered to restore the patient to health. When we treat acute diseases, we should consider the causation, the generals, mentals, the modalities, and then select the suitable remedy from materia medica and use it in low potencies repeatedly at short intervals. In patients suffering from such disease like cancer and TB, when the disease is advanced, generals and mentals disappear and only modalities remain. We should try for palliation only, and cure is not possible at this stage. In homeopathic medical system, treatment based only on physical symptoms like bleeding from the nose, difficulty in labor, etc. is very much difficult. When the generals of the patients are identical to those of the remedy indicated by the local symptoms, administration of that remedy will result in cure. Rarely, in some life-threatening acute diseases, physical symptoms can be observed. We can depend on them to give medicine in trial and error method and try to save the patient. In some patients who are about to die, we can save life by using remedies such as China, Carbovez, Arsenicum album and camphor. Now we will try to learn another new topic, law of cure. Dr. Hahnemann identified those principles upon which nature cures diseases in living beings. He declared that by following the same principles in treatment, we can prevent and cure diseases easily. He gave these principles in his masterpiece Organon. They are: 1. When a person is suffering from a disease, if another disease which has the ability to cause the same symptoms more intensively attacks him, the former disease will be vanished from the patient permanently. Example: if a person is suffering from cough, cold, sneezing, diarrhea and skin rashes, and if he is attacked by smallpox, which can cause the same totality of symptoms more intensively, the previous disease will be cured permanently. 2. When a patient suffering from one disease gets affected by some other disease which is more strong and severe with no similarity of the symptoms, the former disease disappears completely and temporarily and recurs once the second disease is cured. Example: a patient suffering from edema for 10 years gets fever. Then edema disappears. It recurs as and when fever recedes. 3. When a patient suffering from one disease is affected by another disease whose symptoms are quite opposite to those of the first one, the same thing happens as in the second situation explained. That is, the first disease disappears initially and then recurs as and when the second one is cured. Example: suppose a patient suffering from chronic constipation is affected by cholera. He gets too frequent diarrhea. Constipation recurs immediately after cholera is cured. 4. If a patient suffering from one disease is affected by another disease which is less powerful, the second disease will have no effect at all, whether the symptoms of the two diseases have similarity or not. Example: suppose in a patient psora is settled. Psora itself prevents eruptive fevers, typhoid and cholera. Swasti. Thank you all.